Hello and welcome to the BBS show. My name is Jonathan and I am your regular host on the show. Now, if this is your first time here on this channel, hello and welcome. Consider subscribing to this channel if you want to get more information, education and awareness on the dangers that predispose to cancer and how you can avoid this dreaded disease called cancer. Now, we also provide support to individuals who have been directly or indirectly affected by this deadly scourge. It is a scourge. Okay, the BBS show is supported by the Magdalene Iyamu Cancer Foundation. Now, several years ago, my mother died from complications of ovarian cancer. The cancer in her body, which started as a malignant lump on her left breast, metastasized to other parts of her body and later it led to her death. But that unfortunate but glorious incident, as I would like to call it, became the stepping stone to create the foundation, the Magdalene Iyamu Cancer Foundation. And the MICF has become a household name, and many people, due to this MICF, have become cancer advocates in ways to ensure that people don't go through the situation that my beloved mother passed through. Hence, we come here on the BBS show to provide this enlightenment on YouTube, courtesy this show. Now, today we shall educate ourselves on this dreaded disease, cancer, and we shall be talking about ovarian cancer specifically. Cancer is silently taking the lives of women around the world, so it's very important that you know this. I'll be right back. Ovarian cancer is a type of cancer that begins in the ovaries. The female reproductive system contains two ovaries, one on each side of the uterus. Right? The ovaries in the female, each about the size of an almond. You know, an almond, that's how the size of an ovary is, produces eggs, or what we call ova, as well as the hormones estrogen and progesterone. So you just need to know what the ovary produces. All right. Ovarian cancer often goes undetected until it has spread within the pelvis and the abdomen. At the late stage, ovarian cancer is much more difficult to treat. Yes, I know that. It took the life of my beloved mother. Now, early stage ovarian cancer, in which the disease is confined to the ovaries, is more likely to be treated successfully, all right, when it is very, very early. Surgery and chemotherapy are generally used to treat ovarian cancer. So when cancer has been seen, yes, they use surgery to remove it, and chemotherapy drugs helps to kill other small cancer cells that will grow. Now, early stage ovarian cancer rarely causes any symptoms. So unfortunate, the early stages, it doesn't cause any kind of symptoms. But advanced stage ovarian cancer may cause few and non-specific symptoms that are often mistaken for common benign conditions, some other kind of conditions. It might not be cancerous, but it's been mistaken. Simple signs and symptoms of ovarian cancer may include abdominal bloating or swelling, quickly feeling full when you eat. You just feel full when you eat even just a little amount of food. Now, uncontrolled weight loss. You also have discomfort in the pelvic area, and of course changes in the bowel habits such as constipation or a frequent need to urinate. These are just common signs. But if you experience any of these symptoms, you need to know when to make an appointment with your doctor or your medical professional. Now, make an appointment with your medical professionals if these signs or symptoms continue for a very long period of time. It becomes abnormal because you can't have the highlighted symptoms for a very long time. And also, if you have a family history of ovarian cancer or breast cancer, you need to talk to your doctor about your risk of ovarian cancer. You need to do this as soon as possible. Your doctor may refer you to a genetic counselor to discuss the testing for certain gene mutations, okay? These gene mutations might increase the risk of breast cancer and ovarian cancers. All right, now let's talk about the causes of this ovarian cancer. It is not clear what causes ovarian cancer, though doctors have identified some factors that can increase the risk of this disease. It's a deadly disease. In general, cancer begins when a cell develops errors in its DNA. And when cells develop errors, that's what we call mutation. These mutations tell the cell to grow and multiply quickly, creating a mass or a tumor of an abnormal cell, okay, or abnormal cells. These abnormal cells continue living when healthy cells die. All right, this is when the stage of cancer. They can invade nearby tissues and break off from an initial tumor to spread to other parts of the body. All right, and when it spreads from other parts of the body, the process is called metastasis, or the cancer metastasizes. All right, so that's just a brief overview of what cancer is. Now, the risk factor that can increase the risk of ovarian cancer may include getting older. Ovarian cancer can occur at any stage, but it is mostly common in women between the ages of 50 and 60, all right? 50 and 60 years old. Now, you also have inherited gene mutations. People get, these are risk factors. A small percentage of ovarian cancers are caused by gene mutation. The gene mutation you inherit from your parents or from your bloodline. Remember, we talked about family history. The genes are known to increase the risk of ovarian cancer, and these genes might include the breast cancer gene 1 or the BRCA1 gene, and the breast cancer gene 2 or the BRCA2 gene, popularly called. These genes also increase the risk of breast cancer, so you just have to watch out and know your history. Now, other gene mutations, including those associated with Lynch syndrome, are known to increase the risk of ovarian cancer. So people with 2 or more close relatives with ovarian cancer have an increased risk of the disease. You also have the estrogen hormone replacement therapy, especially with long-term use and in large doses. These factors increase the risk of ovarian cancer. Beginning menstruation at an early age or starting menopause at a very later age, or both, may increase the risk of ovarian cancer. So these risks I have highlighted, you have to really look into them and look at yourself and look at your history so as to know how to go about it, all right? Now, looking at the types of ovarian cancer, okay? The types of cell where the cancer begins determines the type of ovarian cancer a patient has. Ovarian cancer types include the one we call epithelial tumors. These tumors begin in the thin layer of the tissue that covers the outside of the ovaries. Okay, this kind of ovarian cancer is very rampant. About 90% of ovarian cancers are epithelial tumors. Okay, other types of ovarian cancer include stroma tumors. This begins in the ovarian tissue that contains the hormone producing cells. All right, that's the stroma tumors. The tumors are usually diagnosed at an earlier stage than other ovarian tumors. So these are talking about the stroma tumors. All right, about 7% of ovarian cancers are stromal in nature. And of course, other types of ovarian cancer include germ cell tumors. This begins in the egg producing cells. These are rare ovarian cancers and they tend to occur in younger women. That is the germ cell tumors. Okay, so these are the main types of ovarian cancer. Now let's talk about ovarian cancer prevention. Okay, now there is no sure way to prevent ovarian cancer. It's so sad, but there is no sure way to prevent ovarian cancer. But there are ways to reduce the risk. some ways are very necessary, because since old age is one of the risk factors, there is no sure way we can prevent it, but there are things we can do to reduce our risk. Now, the things you can do to reduce your risk involves consider taking birth control pills. Right? Ask your doctor whether birth control pills may be right for you. All these things we have to carry our medical professionals along. Women who use oral contraceptives may have a reduced risk of ovarian cancer, but oral contraceptives do have their own risk, right? So discuss whether the benefits outweigh the risk based on individual situation. That's why we need to talk to our doctors. All right, discuss the risk factor with your doctor. But taking oral birth control pills helps to reduce ovarian cancer. Now, if you have a family history of breast and ovarian cancers, you have to bring this up with your doctor. Okay, your doctor can actually determine what this means for your own risk of cancer. All right. In some cases, your doctor may refer you to a genetic counselor who can help you decide whether genetic testing may be right for you, or if you are found to have a gene mutation. If you are found to have a gene mutation that increases the risk of ovarian cancer, you may consider surgery to remove the ovaries of the patient. So you have to remove the ovaries in that situation so as to prevent this cancer, this kind of deadly cancer. Ovarian cancer is really deadly. All right. Looking at the diagnosis, tests and procedures used to diagnose ovarian cancer include pelvic examination. All right. During the pelvic examination, your doctor can insert a gloved finger into the female genital organ and simultaneously press a hand on your abdomen to feel or to palpate your pelvic organs. Okay, these things are done to diagnose if a person has an ovarian cancer. Now, the doctor also visually examines your external genitalia, the genitalia of a female. You can also do imaging tests, tests such as ultrasounds or CT scans of your abdomen and your pelvic area may help determine the size, the shape and structure of a female ovary or of the ovaries. So you can also diagnose ovarian cancer through blood tests. Okay, tests might include organ function tests that can help determine your overall health. Okay, now your doctor might also test your blood for tumor markers. These are just ways to diagnose ovarian cancer. Your doctor may also test your blood for tumor markers that indicate ovarian cancer. For example, a cancer antigen test can detect a protein that's often found on the surface of ovarian cancer cells. So these tests cannot actually tell your doctor whether you have cancer, but can give clues about your diagnosis and your prognosis. Other ways of diagnosis include surgery. Sometimes your doctors can't be certain of your diagnosis until they undergo surgery to remove an ovary and have it tested for signs of this ovarian cancer. Right? Ovarian cancer is really deadly. So I'm taking my time to explain how the different factors that has to do with it. Now, once a test has been confirmed that the person have ovarian cancer, your doctor will use information from your test and procedure to assign the cancer stage. All right? The stages of ovarian cancers are indicated using Roman numerals, just like every other cancer, ranging from 1 to 4, ranging from just like every other cancer, with the lowest, which is 1, indicating that the cancer is confined to the ovaries. That's stage 1 cancer. But at stage 4, the cancer has spread to other parts of the body, and this is deadly. So we just have to take good care of ourselves and be conscious about our health. Now, the treatment of ovarian cancer usually involves a combination of surgery and chemotherapy. Right? There are many people, when they hear the word surgery and chemotherapy, it's devastating. So check our videos on how to manage chemotherapy and surgery. All right? Surgery operations to remove ovarian cancer may include removing one of the ovaries for very early stage cancer that hasn't spread beyond one ovary. Surgery may involve removing the affected ovary and its fallopian tube. These are the different surgeries that are involved. The procedure may preserve your ability to have children, but surgery to remove both ovaries, if the cancer is present in both of a patient's ovaries, but there are no signs of additional cancer, the surgeon may remove both ovaries and the fallopian tubes. This procedure leaves your uterus intact, so you may still be able to have children or become pregnant using your own frozen embryos or eggs if you're interested in having children. But surgery to remove both ovaries and the uterus, if the cancer is more extensive and has spread to other parts of the body and the patient may not wish to have children, but if they have to remove all these organs, then you won't be able to have children, but you will be able to preserve the life of these patients. So it's very, very important. So that's for surgery. But chemotherapy is also a drug treatment. It differs from surgery, but it uses chemicals to kill fast-growing cells in the body, including cancer cells, right? So chemotherapy drugs can be injected into the vein or it can be taken by mouth. Sometimes the chemotherapy drugs are injected directly into the abdomen, which is called intraperitoneal chemotherapy. Chemotherapy is often used after surgery to kill any cancer cell that might remain. It can also be used before surgery. Other ways of the treatment for ovarian cancer include targeted therapy. Now, targeted therapy uses medications that target the specific vulnerabilities present within the cancer cells. Targeted therapy drugs are usually reserved for treating ovarian cancer, the kind of ovarian cancer that returns after initial treatment or the cancer that resists other treatments. So we use targeted therapy to do that. Doctors may test cancer cells to determine which targeted therapy is most likely to have an effect on the cancer. Other treatment methods also involve supportive or palliative care. Palliative care is a specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. Palliative care specialists work with a patient, the patient's family, and other doctors to provide an extra layer of support that complements ongoing treatment. So we use palliative care in consonance with other kind of treatment. Palliative care can be used while undergoing other aggressive treatments such as surgery and chemotherapy. When palliative care is used along with all of the other appropriate treatments, people with ovarian cancer or generally cancer may feel better and of course live longer. So palliative care is provided by a team of doctors, a team of nurses and other specially trained professionals to provide this support, and of course it aims to improve the quality of life of people with cancer and of course their families. A diagnosis of ovarian cancer can be overwhelming, no doubt. I went through it when my mother was diagnosed, and it can also be scary. In such time, you'll find ways to cope with your feelings, but in the meantime, you might find it helpful to find someone to talk to. Yes, it's very, very important. A lot of people are diagnosed with cancer and they feel that is the end of the world. This time, when someone is diagnosed with cancer, look for someone you feel comfortable enough to discuss your feeling with. You can do this, you can discuss with a friend, you can discuss with a family member, or you might prefer meeting a formal support group. Support group for families of cancer survivors are available. So when you're going through this process or going through this ailment, don't feel left out. It is very good to have support. Let people help you. You just have to allow yourself to let people help. Many people just they live in a closed circuit. So talk to people. Cancer treatment can be exhausting, okay? Let people know what will be most useful for you. Set reasonable goals. Having your goals help you feel in control and can give you a sense of purpose, all right? And finally, on the program today, the BBS show, and don't forget we're talking about all you need to know about ovarian cancer. You know that cancer is a devastating disease and it changes any of its victims' course of history, all right? Please be vigilant, be health conscious, and of course, be prayerful. In the nearest possible time, we will get to see the treatment, basic treatment or a vaccine or a kind of a medication for the treatment of cancer, all right? So be vigilant, all right? Now that's our program today. Please don't forget to subscribe to our channel, the BBS show, like and share our videos on this channel. We also carry out caregiving within our budget. So if you are out there, you can take advantage of our caregiving platforms. So subscribe to our channel. If you know how we can be of help, kindly contact us via our information on the screen. All our information is on the screen. So contact us how we can be of help. We will be glad you did. Thank you for watching. Please take care of yourself and each other. God bless you and bye-bye.